Hello. Do you remember the year President Obama came to Ghana? Well, that's a year that I don't want to remember. Why? Because my daughter was killed in a big hospital in Accra. This I don't want to remember because it was I had two boys, and that was the only daughter I was going to have, and I lost my daughter. And I say she was killed because of the circumstances leading to her death. And so I do not want to talk about it a lot because it invokes a lot of passion and a lot of memories, bad memories for me. But it is important that we recognize, and I know that many of us have experienced bad treatment in hospitals, have had lost loved ones just like I did, and all of that. And so when the issue of the behavior of health professionals come up, oftentimes out of these emotions, we would literally paint everybody with the same brush. And I have had the opportunity to teach health professionals leadership development, and one of the things that I always talk about when I teach this is to sing a song that I intended that song would communicate a message. And that song is a key song that says, I'm sure you have heard it before in funerals, Okwa yaresaba na uwafano Odru yefunu wentu miansheno Okwa yaresaba na uwafano. And that song in Twi actually means someone visited the hospital seeking for healing, and the healer could not heal him, and death took him away. Now, usually this song is sung in funerals, usually church, memorial services for people will sing this song. And this song conveys a lot of bad memories for anyone who has lost someone, especially if this person died within some mysterious circumstances or some bad circumstances in health facilities. So oftentimes all of us feel very emotional about this. And I must say that sometimes the style, the work attitude of most health professionals would typically warrant the attitude and the behavior that people have towards them when there are issues of this. But I want to end on the note that, listen, it is not every health professional who is a bad health professional. And because I teach leadership development, I've had the cause to invite students who are all health professionals to give testimonies of their own colleagues who are bad guys, and also to give testimonies of their colleagues who are actually great physicians and health professionals. And often names will be mentioned and descriptions will be given to demonstrate how excellent some health professionals are. In fact, how health professionals break their backs to be able to get the health systems working and to be able to save people, including in many cases these health professionals would stay beyond their own schedules, would actually pay for medication for a client. They would actually give some patients money to be able to go home, and many such breaking back sacrifices that they make. And within these challenges that health professionals face, I think it's important that we do not condemn all health professionals. I advocate that we call out all health professionals who do not give of their best. That is why in most cases they have tags that have their names. So let's name individuals who don't do the right things. But I think that we would demoralize and actually dampen the spirit of our very hardworking ones who go the extra mile to save lives in our health facilities. So please, my fellow countrymen, let's hold the legs of those who don't do their work to the fire, but let's also celebrate health professionals. And under this post, I want everyone who has received an excellent health service from any health professional before to come under it and post this individual, and let's celebrate them. because the more we celebrate great physicians and great medical professionals, the better the others will want to become. Thank you very much. Nyame tiase, ebe ye.